Today, we have an exceptional program. I won't go into details, and we sent it out and explained it a little bit. But there is a Sangamon County Health Needs Assessment process, you might say. And fortunately, I think for all of us, Memorial St. John's and the county has worked together on that. We've had the program on before, and it is, it at least is one of the really excellent examples where different groups are working together on behalf of the citizens of Sangamon County. So I would like to introduce Gail O'Neill. Gail is the Public Health Director of Sangamon County. Been director, I think, 3 years, was assistant director before that, and she will introduce our other guest. Thank you. Go ahead.
Good morning, and thank you. We'll make sure you can hear us this way this morning. So we are here, and I think each of us is going to kind of explain our roles in this matter today, but I am the director of the Sangamon County Department of Public Health, and this is our third opportunity between St. John's and Memorial and the County Health Department to do a requirement that's required of each of our organizations and to do it in a cooperative manner. The Illinois Department of Public Health requires that I-Plan, the Illinois project for the local assessment of needs, is done at least every 5 years. We have to have a community assessment and come up with some plans and things that we may be able to make an impact on in our community. You want to change the slide? That would be great. So the I-Plan's requirements is every 5 years we do an assessment and come up with some plans. And then 9 years ago, about the IRS put some rules to the hospitals, and they also needed to do a community assessment and come up with some interventions and activities that they could do to improve the health of their local communities. So the health department was able to, and it's grown over the years. We were one of the first ones in our community to combine our efforts and come up with a 3-year cycle for these kind of plans. Instead of each of us doing our own things, and you always hear about silos, which we have a lot of, we are really been working on breaking those down. Exciting for the health department is generally we don't have funds to do much. We can write plans and we can do with what we have, but the last 9 years has given us an opportunity to partner with the hospitals and actually support through our staff and without much financial resources to be involved in some pretty exciting things. So that's required. Hospitals have to do this. And then we really need to identify those who are medically underserved and the minoritized populations and really speak on their behalf. And I think as you'll hear today, there's really been a concerted effort to make sure that everybody's reached out into the community. So it has to be drafted. This community health improvement plan needs to be addressed, and actually their rules are a little even harder than ours. For this one little part of our certification, the hospitals have to say why they didn't pick the other ones and a whole nother explanation. But anyway, this partnership with the hospitals has led to great things, and it's really exciting for us. So what we'll try to do is switch the slide. Give you a little bit of background about the things that we had proposed last time. The goals that were identified that the Sangamon County Board of Health worked on and identified were child abuse based on the data and what we were hearing in our communities, access to care, and asthma. So we really, with child abuse, looked at more education of our staff, that we have a lot of nurses and professionals that work with young families, WIC and case management. So we wanted to make sure they had as much education as they could about reporting and DCFS. We participated with the Access to Care group and provided support, training, no dollars really, but training and partnership there. The Access to Care, we did a bit with community resources and SIU School of Medicine. Asthma was a high priority. We had some good ideas for that. We didn't get nearly as far with any of these, as you'll know later, as much as we would have liked to. The Board of Health also always wants to, and the title that we're allowed to give them are strategic initiatives, other things that may not have shown up data-wise as important, but the Board of Health continues to be concerned about infant mortality and infant maternal issues, and those went along with some of the projects for the last few years, and sexually transmitted diseases, because we're the organization that's role is and responsibility is to focus on that and our continual high numbers. Kim Luz is not here today with us. She's usually part of our team. She's she's with St. John's Hospital, so I'm going to cover her slides. Give me the next slide. She has encountered one of the things that we've all done for the last few years, or the last year and a half at least, had a family member involved with a positive COVID, and she'd been there, so to keep all of you safe, she's staying home and airing out the house and waiting a few days to get tested herself. So we all have had to learn to punt that way in the last few years. So I'll just go over their priorities. So access to care from St. John's, HSHS St. John's. They expanded access to the Health Collaborative with SIU School of Medicine. That was Enos Park area and has expanded to Pillsbury Mills area. Established and expanded a hands and feet clinic to connect people with experiencing homelessness to some other wraparound services of health care, mental health, behavioral health, and coordinated entry services. You may not think of hands and feet being a very important part of services that we kind of take for granted. SIU School of Medicine, they provided a subsidy. The Kumler Pharmaceuticals Program received some support from HSHS. They too looked at what we called child abuse as child maltreatment, so trauma-informed care training so that staff would be sure to understand adverse childhood experiences. They provided more than 60 social service agencies, healthcare agencies, and 20 schools training and information on trauma-informed care and how it affects our communities. Human trafficking fell under this too as maltreatment. Human trafficking trainings, protocols, and trying to make sure that the emergency department was well aware of identifying and having a policy to follow if there was human trafficking suggested. They also had a maternal infant health initiative, which we all participated in and learned a lot, sad and hopeful. The Safe Sleep campaign partnered with the health department and Memorial Health, and quite a bit of help for our understanding initially with the coroner's office as well. The hospital continued to fund a home visitation program to focus on baby brain development and access to health care for babies that were born less than 32 weeks that had been in the NICU. And one of our other problems that comes up for all of us is substance use. So they participated with us and the hospitals with the Sangamon County Opioid Task Force and Education Subcommittee, partnered with the hospital's School of Nursing to plan and implement an inaugural opioid education events to the healthcare students. From the School of Nursing, SIU, and Lincoln Land. Now this is an annual event that provides care, treatment, management of patients with opioid use disorder across the care continuum. And finally, the Substance Use Disorder Screening and Warm Handoff Program launched in the Emergency Department in collaboration with Gateway. The warm handoff's become a wonderful term to say, we're not just pushing you out. You are going to, if you've identified you with a problem or a way we can help, we're going to make the call, or they will make the call to Gateway, to a voice where you can have a trust. We get referrals for anything that we need healthcare-wise, but especially in these really hard situations, the warm handoff, I'm handing you to a person. I'm not saying, and we have an appointment or you have an appointment at a certain time, or just to not say, go find it yourself. We're really trying to work more as a community with warm handoffs. So that is where we do. Let's change the slide so you can see what happened during all these wonderful plans as then COVID came. I became the director, and within a few months had a new experience, and all of us were plunged into a situation where we had never been before, and we are still doing. So keeping in mind, that's why we've had a little bit, at least from the health department's perspective, a switch of focus, but still many of those priorities continue through. We wanted to make sure we had equity in clinics and had a coordinated big partnership, which we needed. Response, make sure we were providing basic needs to people who we suddenly said, you have to go home and stay there, especially in the beginning, and don't do anything, don't even open your door, pretty much. So people needed help and resources that we quickly learned, and that was a community effort to provide. A lot of people needing PPE. Nobody's stocked up on masks and gowns and gloves to this level in the past. Suddenly people needed to be tested, and who could do it where, what we could support. I mean, in the beginning of this, it's hard to remember that they had to have approval to even get a test. So it went from having a little control and knowledge what was going on to where we are today. There's a lot of community education, communication, isolation assistance. I mean, there's been opportunities and situations where people just could not isolate from the family, or people didn't have a safe place if they were in a group environment, if they were experiencing homelessness, where the organizations work together and we are prepared to provide that service. But you can't just put somebody in a hotel with no food and no medicine and say stay there for 14 days. It's really difficult. And the more difficult people's normal life situation makes that another challenge that takes a lot of us to work at. And all these were coordinated through an incident command system. It's one of those things you practice for all the time, and you practiced since September 11th, but we actually put that into place early on, and every organization, the community, the hospitals, we had the hospitals and SIU and Springfield Clinic and us, we had a group of 5 of us, but media messages all went out together, and we made sure everybody was on the same page. And worked this operation together. But the incident command system required everybody to come in and see what happened overnight. How many people are we losing from the EMTs? How many are sick in the police and fire departments? What do? We share odd things. The fire department started to report that people were not going to the hospitals and when they should have been. Because they were having heart attacks at home or coming too close to having a stroke, and the perception that you couldn't go to the hospital without a danger. Those kind of things we shared and worked on together. There were subcommittees, and it was a massive operation. It was very impressive, and a lot of it still continues. In fact, we have daily calls. First we have the meeting, and then we have daily calls with a group of physicians. We're still having calls with the physicians and the hospitals twice a week, so it's come down from 5 days a week, but it is still an effort that we're working on. So our relationships as a community of healthcare providers has grown immensely in the last couple years. I think that's one of the best benefits that we've had from this, and fortunately we had already been, the 3 of us had already been working together a lot, but it gave us a focused approach. So we do look forward to these new operations, and let's switch again. To our highlight. Nope, that's you. I had my mind out of order. Thank you. There's Becky.
Good morning. I am Becky Gabney. I'm the System Director of Community Health for Memorial Health, and I'm excited to be here today. I'm also excited to see several friends in the audience, so thank you for coming and caring about this process that is very near and dear to all of my colleagues here, and Kim, who's at home. I really appreciate Gail sharing about the collaborative nature of this work, as well as the serious impact that COVID-19 had on our plans for this year. And this work really to us is a mission imperative, and so even before these mandates were in place, the hospitals were doing these needs assessments. Because to us, we don't want to be trying to do things and coming up with our own ideas of what the community needs. We want to hear from our neighbors what they want us to focus on. So for the last cycle at Memorial, we named 4 priorities, and that was access to health, mental health, substance use, and mother-infant health. So several of the things that Gail highlighted from Kim Luz's work with HSHS St. John's is mirrored in our substance use and mother-infant health work. So you'll see that in much of the things that we talk about today, we are all kind of working together on those initiatives. So I'm not going to spend a lot of time on those areas. What I really want to do is highlight a couple of things under access to health and mental health. And I think that's indicative too of this pandemic that we're in, and that these are 2 priorities that have just really come out of the pandemic that have been highlighted. So under access to health, the first bullet there is the Springfield Immigrant Advocacy Network, SION, and we actually have a SION member here in the crowd who I was excited to see earlier. We were able to provide a small amount of funding for their work, and I encourage you, if you're not familiar with the work that they do, to learn about it, go online and look it up. It's really important work that's happening, and so this was able to help meet some of the gaps in health needs and some work that they're doing. We also contributed, I think, over $5 million to build the new YMCA downtown, and donated the land that is on, and things like that. So the third bullet point there is the SIU School of Medicine subsidy, and St. John's also provides a monetary, donation block grant to SIU School of Medicine. Memorials is to the tune of over $40 million, and that's very important to us. From a point of access, we are a stronger community by having SIU here with us, and they are an excellent collaborative partner between the two hospitals. So when we look at access to care, we're trying to take a broad approach of how do we fund, some of these institutions that we really need here to continue, expanding access, and what are some of the really nuanced, grassroots work that's happening, and how do we fund and support that as well. Looking at mental health, we've got several initiatives that we have focused on, over the last 3 years. One of my favorites, and I think the one that is probably receives the most wide praise, is the COET program. So this is a co-responder engagement team, and essentially these are mental health professionals that go out and respond with police officers here in Springfield when there's a mental health crisis going on, or if there's someone who's experiencing homelessness and they need to get really connected with services and they're not kind of coming in through the formal channels. These co-responders go out. So we've done a lot of kind of deep dive with the Community Health Roundtable and had some strong recommendations to continue this program and to increase its funding. As we experienced, the kind of collective frustration and anger, 2 summers ago with the murder of George Floyd, there was a lot of talk about how do we embed mental health professionals with police officers or do respond to these calls differently. And we were happy that we already had this work going on and had the infrastructure and are in the position to, hopefully expand that. If you want to go to the next slide. Great. So one program that I want to highlight specifically is the Access to Health program. And this, SIU administers this, and it's in collaboration with St. John's and Springfield Memorial Hospital. The health department also helps connect with resources and things like that. But what this is a community health worker program that embeds community health workers within specific neighborhoods or with specific populations. So the 2 neighborhoods that our program has focused on over the last 6 years, because this is the second cycle we've done this program, is the Pillsbury Mills neighborhood as well as the Enos Park neighborhood. We've also tried to build some relationships with the folks who are working with the different immigrant populations here in Springfield, and we hope to have that as a focus in this next cycle we're coming into. We have some really great outcomes here. So one of which is that we track the self-sufficiency scores for clients that are participating in these programs. And within the Enos Park neighborhood, there was a 39% increase in those self-sufficiency scores. We've also found that this program is doing a really good job at connecting with people of color and bringing them into the system to, access that health care that oftentimes they have been kind of marginalized and boxed out of. We also saw a reduction in crime. So when this originally started a few years ago, we saw this really powerful decrease in crime initially within Enos Park. So it's been interesting to see with this whole, study, as we kept this program going, would we see that show up in other areas? And we certainly have. So there was a 6% reduction in calls in the Pillsbury Mills neighborhood during the first year that we had this program open, and that was actually the lowest rate of calls and the first decrease they had seen in the 3 years before. So that was really, really neat to see that. Our community health workers have also been embedding with the residents at the Hope Springs apartments. And they saw a 30% reduction of crime with that partnership there as well. So there's some really neat outcomes coming out of this program. And I think for us, it speaks to the importance of walking alongside community members. So we try to hire folks from within the community, that are trusted individuals and that can work, alongside those neighborhoods and the people who are neighbors and friends, and help them access that health care. And so when we do that, and we do that well, we have some really impactful outcomes. Ling Ling is going to come up and start sharing a little bit about the actual process for this cycle of the CHNA, but we wanted to provide that update of what we've been doing since the last one.
Thank you, Becky. Good morning, everyone. Welcome, and very good to see you. I was sharing with Bob Gray earlier that this is my very first in-person meeting since the pandemic, so it's been a while. Wonderful to see everyone. My name is Ling Ling Liu. I am with Memorial Health. My role here is the Community Health and Equity, Diversity, and Inclusion Program Coordinator. I've been involved in this work for a little over a year, so I've had the privilege of working alongside Becky, Gail, and Kim Luz with St. John's from the beginning of the CHNA process. So from here on, I'm going to share a little bit about how we started the process and some of the steps we've taken to kind of help us identify the priorities that we have arrived. When looking at the community health needs assessment, there are 4 defined criteria that we use to kind of help us decide the final priorities. They are the triple aim impact, which kind of looks at improve the health of individuals, improve the health of populations, reduce waste, variation, and healthcare cost. And also we look at the magnitude of the issue. So how wide is this issue in our community? And we look at the seriousness, so how these issues are related to mortality, cause of death of those individuals that are affected in our communities. And then we also look at the feasibility of these issues, our ability to kind of make a huge impact in those areas, considering the available resources that we have. What are some of the areas that we're most likely to make a huge improvement? Next slide, please. And also throughout the CHNA process, we took into consideration 3 major contributing factors that are really in all aspects of our health needs assessment. They are access to health and healthcare, social determinants of health, racial inequities, and inequalities. And so first looking at access to health and healthcare, there are really 3 aspects that we look at: structural, financial, and personal. Structural is the availability of providers, services, facilities that are available in our community, and also how they're organized in a way that's either easily accessible by individuals or whether or not they're kind of posing structural barriers for folks to access. And also, do we have transportation to get folks to and from their appointments? Financial has everything to do with insurance and folks' ability to pay for their medical bills after insurance coverage. Do they have a very good reimbursement level, and if folks are not able to pay the medical bills that's out of pocket, is there public support available to kind of help folks out? And then personal has a lot to do with one's own culture, identity, whether or not it is acceptable for someone to seek care on certain issues. Culturally, there are a lot of taboos in different communities that we may or may not be aware of that's affecting individuals' decisions. Language barrier is certainly a huge deal for our immigrant neighbors. Do health systems have enough interpreters in our community to help people in their daily interactions with the health systems? And then personal attitude, your education level, your income level also plays a huge role in your personal decisions when it comes to healthcare. Next, please. Social determinants of health is the conditions in our environment that we live that can affect our health outcomes and risks. You can see on the graphic to the right that this is the American Hospital Association slide about social determinants of health. They are really encompassing the factors that kind of affect our health outcomes. So at the top we have socioeconomic factors. They are your education, your job status, family and social support, income level, and community safety. And next we have physical environment. And together these two really encompasses 50% of the factors that affect your potential health outcomes. And they all can be traced back by your zip code. And then next we have health behaviors such as tobacco use, diet and exercise, alcohol use, and sexual activity. These behaviors can also be affected by the other issues you affect in life, such as your mental health challenges, because a lot of the times the behaviors are kind of your coping mechanism when it comes to health. And then last but not least, 20% of the determinants of health is healthcare, and that is the part of activities that actually happen in a healthcare environment, such as a clinic or a hospital. Next, please. And the last factor we looked at is racial inequities and inequalities. We often use this graphic in equity work to kind of emphasize and underscore the importance of equity over equality, because we all have individualized needs. If you look at the equality part of the graphic, every person in this family was given the same size bike, but unfortunately, not everybody is comfortable taking a family bike ride on the same bike, right? Because there's a smaller person, and then there's a person on the wheelchair, and then there's a really tall person that's uncomfortably riding the bike. Whereas in equity, everybody gets an individualized, customized bike to kind of meet their individual needs. Now, realizing that every person in this family is a valuable member and they have equal worth and importance in the family, it is really important that they are empowered and given the resources to be able to participate in this family ride together. So these are the factors we kind of considered throughout our process. Next slide, please. And with these factors and the 4 criteria in mind, we started the process of CHNA by diving into kind of the existing data that's available from different primary sources. On the left, you can kind of see some of the examples of the resources, such as county health rankings, emergency departments comp data, healthy communities data platform that's kind of available on our website. And also, I want to call out the Citizens Club survey. That's a very important resource that we refer to, kind of complements with the data we have elsewhere. So I appreciate those who are involved in this survey. So from there, we were able to identify 14 priority areas. And you can see from the list here, we have access to behavioral health services, access to mental health services, affordable housing, disparities in education, food access, homeless issues, maternal infant health, obesity, senior health, tobacco use, unemployment, unmanaged chronic conditions, utility and rental assistance, and violence. Next slide, please. And from there, in order to get a kind of a deeper understanding and deeper dive, and to kind of zoom in on some of the issues and narrow down to the final priorities, we formed an external advisory committee that kind of represent different areas of our community who are, feet on the ground doing the real work with the individuals in the community. We were able to together a group of community leaders, individuals that are from the list of organizations here. As you can see, they represent different communities, our immigrant community, faith leaders, healthcare, schools, higher education, etc. And in that meeting, we had presented data as well as anecdotal information of each of these priorities that we identified from the secondary data dive. And we asked the participants at the end of the presentation to kind of choose their top 5 priorities. And from there, we were able to rank 7 priorities out of the 14 that are really concerning according to the community leaders. And they're access to behavioral health services, access to mental health services, disparities in economy, disparities in education, food access, homeless issues, safe and affordable housing. And from here, Becky's going to share more kind of how we further narrowed down the priorities.
Thank you, Ling Ling. I can't emphasize enough how much help Ling Ling was through this process. She came onto my team, partway into this work, and I feel like it would not have been, I don't even know if it would have been completed or done as well, at least for our part without her, so thank you. Okay, so after we reviewed the data and talked to kind of the organizations in town that are, doing this work, then we wanted to get a deeper understanding from the community members and different kind of representative groups of what their needs are and how are they experiencing these metrics that are identified in the data and from our Community Advisory Council. I also want to note here that we were given feedback on our previous cycle that we didn't have enough representation from folks who did not have a high school diploma, missing the word, as well as just needing to be more representative in kind of our survey feedback. We also, through the pandemic, we're hearing a lot of response that people didn't want another survey. We had the census going on, we were in the middle of an election, people were tired of being surveyed. So thank goodness for the partnership here with the Citizens Club. And so we were able to really use the health focus of that last, the 2019 survey to inform kind of a broad picture of the community. And so then we structured focus groups to really dive deeper with community members of how they were experiencing things. You can see on this list, I'm not going to read through everything, but you can see the different groups that we worked with. We conducted over 20 focus groups. And you can see the diversity reflected here. We have every one from East Side Neighborhood Associations to the Islamic Society of Greater Springfield. We have the Black Chamber of Commerce, the Phoenix Center. We have the Springfield Center for Independent Living. Some of our city council members, one of who I see here. Thanks for being here. So we really tried to get a deeper understanding of how these metrics are being experienced and what we might be able to do to address them. So we structured each of these focus groups with a data review of a couple of the measures, and then we had an open discussion about impact and solutions, and we asked a few key questions like, how is this impacting you? How is this impacting those around you? And ultimately, is what in your mind could the hospitals and the health department be doing to address these issues? And then finally, we asked them to rank their top 3 most important of the measures that Ling Ling described on the last slide. If we can go to the next slide. Okay, so these were the results of the focus group. And I've got a green line kind of dividing the top 4. So the top 4 really scored high. And then the 3 issues you see towards the bottom, they scored much lower than the other ones, but as I'll talk through, there's a lot of connections there. So education was really strongly linked with economy. So it came as a close second, and in all of our focus groups, there was a lot of talk of kind of what comes first. Is the issue that we have economic disparities, or is the issue that our schools are not preparing us? And so there was a lot of back and forth of, what came first. When we talked about housing, and I think we are all probably wondering, yeah, homeless issues, we probably would have expected those to raise higher. However, in our conversations, folks really felt like housing is so strongly linked to mental health, that the root cause here is mental health and behavioral health and that access to health care. And if we can help solve some of those things and focus on homelessness, we really can holistically start addressing that issue. Housing, though, was listed as a really high priority. So you see safe and affordable housing, is fourth on that list. If you combine that with homelessness issues and understand that linkage to mental health, this really is a high priority. And then finally, the bullet point, the last one on here, is access to health came up repeatedly. And this is the second cycle that access to health has organically showed up on our community input. So there were these were not given as options to rank vote, and we still had at least 10 votes that were like, oh no, we need to look at access. And we thought we were kind of addressing that by including it in those major contributing factors, but people felt so strongly that access to health is still a priority. You can go to the next slide. So I want to share some of the general feedback that we got from conducting these focus groups. I think this is really important. So we're not just trying to get information from the community. I think it's important to share what their words and their feedback was, and I hope that everyone kind of absorbs what we see here in this feedback. I'm not going to read every one of these, but a couple of highlights are that folks were really grateful to be included and given a voice. They were also surprised. They were surprised to be brought in this intimately into the process. Overall, there was quite a bit of a lack of trust, and folks really expressing that they need to see action. So one of the quotes is, "This is not new. Why do we keep only talking about it?" And I think that's important. So as we go to folks, especially those who have been marginalized, and say, tell me what we should do, tell me how to help, if we're not helping, we're not really acting on that and making sure that the community can feel that impact, then we're not doing what we're setting out to do. We're going to talk about disparities in economy, but just so to level set, the difference in median household incomes between white and Black or African American households here in Springfield is the worst disparity of any metro area in the whole country. Okay, so that's not the state, it's not the county, it's the entire country. So when you look at Black and African American households, they're making $26,000 is the median household income, whereas for the average median household income is $60,000, and for white households it's $65,000. So here in our city, Black and African American households are making 40% of what white households are. And when you connect that back to those social determinants of health and the enormous impact that those kind of like economic factors have, it's serious. So one of the quotes that I feel like is important to note up here is, one person said, "Disparities in economy are disturbing, but it's not shocking to us. We are living it every day." And that was very telling for myself. I am not in a situation where I'm experiencing an economic disparity, and so when I heard those numbers and saw those statistics, I was floored. And then to hear community members saying, oh no, we're not surprised by this because this is our experience. I think that's really important to center that, someone else's experience might be very different than mine, or some of us in this room. And then to Gail's point earlier, there has just been a significant impact on community members regarding COVID-19. So the economy, mental health, just everything that came up, through and through in this work. I also want to give some credit to the Student National Medical Association with SIU School of Medicine. It's the oldest and largest independent student-run organization focused on the needs and concerns of Black medical students here in the United States. They helped theme all of this focus group data. So there was 3 or 4 of us taking notes on every one of these focus groups, and they helped bring all of those notes together, theme them out, provide us with feedback and data that we could really use. So I want to thank them for their collaboration. We can go to the next slide. Okay, so this is the important part of what are we going to prioritize, and what are we going to be working on over the next 3 years. So each of our organizations have our own sets of priorities that we set with our internal committees, and you'll see a lot of overlap, and then you'll see some variation based on kind of the nature of our own organizations. So economic disparities are going to be a key focus for St. John's and Springfield Memorial Hospital, and we feel really strongly that we're one of the largest employers here in our area, and we really have the leverage and the power and the resources to try to make an impact in this area, and so we're going to try to do that. Mental and behavioral health is going to be a key focus for all of our areas, and we want to note here that safe and affordable housing advocacy is considered a part of that, as well as substance use and homelessness including in that. So we're all working on a lot of work in those areas, and we connect that to that mental and behavioral health priority. Access to health is a key priority across all of our organizations, including chronic conditions and food insecurity. Child abuse and neglect is going to be a key focus for St. John's Hospital, particularly by virtue of them being the children's hospital. Housing safety and chronic conditions, education and resources around those are going to be key focal points for the Sangamon County Department of Public Health. We can go to the next slide. So we've set those priorities, and now we're wondering, what are we going to do about that? So this work is still taking shape. We're still, diving into what is the work happening in the community that we can collaborate and take part of and divert resources to. But a few things that we know off the top of our head are some pipeline and workforce development programs that we'd like to invest in. There's a large project getting started called CAP 1908, which is redevelopment on the east side of Springfield with the intersection of 11th and South Grand. So we're really interested in partnering there and helping embed pipeline programs. We're going to continue COA and Mosaic. Mosaic embeds mental health care workers in our schools, as well as the Access to Health program. And we're looking to really expand that program to serve individuals who experience chronic homelessness. There's a small population of folks who we really need wraparound services for, and so we're going to work on expanding it to those folks, as well as some of our immigrant communities. So through this process, we've identified several pockets of folks who have immigrated here and need different kind of access, resources or supports that they're not currently receiving. And so we're going to try to meet that need through access to health. Anything that you see in green and bold are things that we're collaborating with St. John's on. So you'll see that collaborative nature through much of this. We are doing an equity, diversity, and inclusion gap analysis throughout Memorial Health and making a strategic plan around that. So like we said, we see racial inequalities and inequities just woven through every one of these measures. And so it's important to us to look internally as well as externally of what can we do in these spaces to improve. We're going to continue funding community-based programs. So we provide significant funding to the Boys and Girls Club of Central Illinois, the YMCA. We are going to continue and increase our funding to Scion for their food distribution. I see another Scion friend and Community Health Roundtable member here. We are also helping fund the homelessness strategic plan and providing funding for some rapid rehousing initiatives that have been proposed, as well as continuing that SIU funding. If you want to go to the next slide. Okay. This is going to be the last slide that you have to hear me talking, so I'm almost done, I promise. This is St. John's strategy highlights, and so again, in green are things we're collaborating on, so I'm going to skip over those. They are expanding their substance treatment and recovery program in the emergency department to inpatient floors and physician offices. They also have a Beyond the NICU baby brain development program, and they're going to continue that. They're expanding their crisis support referrals and services for families who are in crisis. And they're also working with community partners and local legislators to factor in health considerations into some of the decision-making affecting local populations. They also have a really neat program for senior transportation to medical appointments and grocery stores, and so there's a considerable amount of resources to coordinate that program, but then they also bring in volunteers who help provide the transportations and rides to these really critical needs. And this is not limited to St. John's patients, so this is widely open to seniors in the community. Okay, those are highlights of some of the things we set out to do over the next 3 years. And I think Gail is going to come up and finish us out with the health department. Thank you.
Well, thank you, As you can see, the first one is green, and we certainly are happy to be able to be a resource support for the access to the health expansion access, and we definitely need that. A couple things that we noticed, because we think we're going to still be pretty busy with COVID, but in talking about safe housing and issues, we thought about working with the Sangamon County Building and Zoning and the local outside of, well, with Springfield, but also in the communities. We had heard information about the need for not so many hoops to jump through to get a wheelchair ramp, and it seems like such a simple thing. So it's something that we can actually probably impact, having some rules changed and maybe some financial resources put that way, some things that we all kind of can take for granted or never even thought about what a process that could be. Department of Community Resources is located in our building with us. It's been something to help each other serve more people. One of the things that we've noticed in the last couple of years is when we've gotten a partnership that the Community Resources provides financial aid and money for people that need dental care or other health care issues. We partner now with them that anybody receiving funding will get some dental education, meet with a hygienist in our office, and provide some information. They're also doing that with some financial support and some banks and other things. So anything that's kind of health related that we have some expertise in, we're partnering. And so it's not just handing out the money, but it's handing out education on how to best to utilize the services. We're going to continue our partnership, of course, with a group from SIU School of Medicine who is helping us try to cover the diversity and the rumors and the distrust and the issues with trying to encourage COVID vaccinations in communities that may decide to vaccinate if they had people they trusted and had their questions answered. We're going to continue, try to explore the continuation of being able to provide mental health first aid. 3 of our staff members, this was funded by Memorial a few years ago, and we found it very valuable with our staff and others. So 3 of us are trained. We just haven't had time, but we're going to try to continue that as we realize how important that is in our community. And, you know, the relationships, as I said before, that we've really enhanced through COVID, we want to continue that and build on it and have stronger relationships for chronic illnesses and information. So we'll be seeing that. Next slide. So the assessments and the plans and copies should be available through each of our organizations. After I saw this, I checked ours. I think I've got to find it again. It's kind of buried under COVID. So it'll be there soon, and both of the facilities. So thank you for your attention, and I think we're going to move to questions.
Yeah, very good. Thank you. Thank you. We've got about 10 minutes for some questions. If you would keep them reasonably succinct. I give you my speech, but it's over.
I was wondering if any of you had an opinion or your organizations had official stance on the legalization of midwifery in Illinois. You know, that's a piece of legislation that they're toying around with right now.
Yeah, so I don't have an opinion or stance necessarily to share from Memorial. What I will say, though, is that we recognize there are tremendous disparities for African American women and Black women in childbirth, and one of the evidence-based practices of bridging that disparity is having doulas and midwives involved in the birth process. So from an equity, diversity, and inclusion standpoint, I'm certainly excited to hear that this conversation is happening.
It's happening at the public health level too. The WIC program and the Better Birth Outcomes are beginning to fund doula services for the exact same reason. So we'll be participating in that as well.
Here.
I was surprised about your announcement that there was a decrease in crime as a result of your assistance. Can you explain that? That was a good outcome.
Yes, it's a great outcome. And I think, so I think many of the conversations we've been having locally and nationally are that, you know, police officers and law enforcement often are given tasks that are really outside of what their expertise is and what they're, originally there to be helping with. And so when you embed, community health workers or mental health professionals, you've got the folks there, in these crisis moments that are able to address those issues and help stabilize folks without it turning into an incarceration or some kind of interaction with law enforcement. And so it's kind of really looking at, okay, whose role is best suited to which response. And so I think that that's a lot of what we see in those reductions of crime, that we've got the right people in there with the right issues helping.
Next one.
Hi, guys. Toby Trimmer, Abraham Lincoln Presidential Library Museum. Simple question, probably hard answer, which is that what can organizations, institutions, and folks in the community do to help implement and support a plan like this?
That's a really good question, and that's something that we need to reach out, I think, as these roll out. Do you have any suggestions so that, the more people participating, the better it is for our community?
Yeah, Ling, did you have any thoughts on this one? I always want to jump in and can talk for all day, so.
The thought I have is to really be a strong advocate within your own circle when it comes to equitable access to health and healthcare, and also in thinking destigmatizing some of the health issues that might be taboo topics for certain groups, certain populations in our community. Just be outspoken, educate yourselves on those issues, and kind of influence your own circle so that eventually we get to a place where mental health is no longer stigmatized, HIV/AIDS is no longer stigmatized. So that's the thought that came to my mind.
Yeah, and I would add that I hope that you look through the actual documents, especially the implementation plans, and look at some of the things that we're planning on working on, and think how might your organization or your personal interests connect to those, and reach out to us, and we can help connect you with some of these organizations we've been working with. So that's much of at least me and Ling's role and Kim's role is playing that connector piece and saying, okay, we've got someone that wants to do this, and we know there's this need, and how do we put these together so that we're kind of mutually helping each other out.
Yes.
How you guys doing? My name's Sean Gregory. I agree. Strong circles, encouraging everybody. In my role that I'm in today, I'm around some very smart people like Miss Gail O'Neill and Miss Becky and things like that, among other people. Sometimes they'll see stress in me or whatever, so they'll push me to take some mental health days and things like that. Things that I would have never done if I hadn't entered this space, if I hadn't started being exposed to these things. And I think for our younger kids and things, exposing them to our health practices and consistently pushing that on to them, because in the world I come from, we just working every day, we're trying to live. And, I'm not going to the doctor until I get sick. I shouldn't. I should go. I should do preventative things, and I know that now, right? Like right now, I need to go to the dentist. But I be so busy, I haven't went yet. But what I have done is I've linked on people, in that experience. Hey, where do I go to a dentist? I grew up in foster care. Everything, all my medical stuff was done for me. So when I got grown, I was running the streets, I was running around. So I never jumped into that mode of going to a doctor consistently, doing those things. So we got to push on our young children of that early, teach them that early. So when they're adults and things, they will know the route to go, and it will continue on throughout life. So I just wanted to share that.
And I want to amplify something that Alderman Gregory just spoke to, and we had it up here on the slide of focus group feedback. A lot of folks really are in a survival mode, and they express that to us. It's very hard to be focusing on healthy eating or mental health when you're trying to put food on the table. It's very hard to prioritize cooking a certain meal if you don't have a working kitchen in your home. So I just really want to amplify that point that sometimes survival keeps us from some of these greater health outcomes.
I wonder if Gail could give us about a minute and a half summary of what's going on in Sangamon County on COVID-19
I can.
and all of its impacts.
The story is similar and sad in some ways. Right now, we're experiencing a big uptick in cases. I think there was 217 new cases identified yesterday for Sangamon County. We had another death, which marked our 300th death for our community since it started, and we have 57 Sangamon County residents hospitalized, which is quite a few. It's because the hospitals here hold lots more than Sangamon County residents, so that kind of is an indication that the hospitals are busy and their staff is being taxed, and the hospitals are kind of bursting at the seams in some places. But the thing that's different this year, which is a little helpful, even though it sounds doom and gloom, is that we didn't have vaccines. In fact, this week is the one-year anniversary of getting vaccine out. Healthcare workers were the first group, and so I think that was 2 days ago was the first day a year ago that happened. Our community vaccination started in January, so we're close to that. But vaccine has played a huge impact in this, at least getting quite a few people early vaccinated, and we aren't seeing the deaths and as much severe illness because of vaccine. And we know vaccines aren't 100%. We've learned as this new disease and new process is going along that the vaccines seem to kind of wear off after 6 months. So our next goal was to encourage people to get a booster, get that extra dose. Those that were immune compromised or really have a hard time developing antibodies be the priority for that. So unfortunately, our vaccination rates have stagnated pretty much. We're just under 60% for our community overall. Those over 65, we've got a huge number of them, vaccinated, and everybody's sick and tired of the masks. But those are the two things that we've got to get through this. The viruses are changing a little bit. We heard about Delta, we were worried. Now we hear about Omicron, which is coming over from Africa and other places. Omicron's a little bit different, but the studies so far indicate that the vaccine works very well against those. It's not as severe of an illness, but it spreads more easily. So that's a challenge. It also seems to have a couple other indicators that are different. So you will have a dry cough, is what we're hearing with that. The night sweats is something we hadn't heard with, and it just takes us hearing from people of what they're going through. And extreme fatigue. We've heard about people being tired and having fatigue, but this is I can't put a foot on the floor get out of bed type thing. So with Delta, we were hearing more of stomach issues and diarrhea and vomiting. Now we're hearing it's a virus that keeps changing enough to stay ahead of us. But as a community, we just still need to fight together, and those that don't want to vaccinate are difficult to change their minds. We pretty much know that. And soon they're going to call fully vaccinated people those with 3 doses of vaccine right now. So yeah, it's not great. This is a Halloween, Thanksgiving, and now a Christmas spike that we'll see for people, especially last year, that didn't get to be with family and friends. We're being very cautious, and they're pretty much tired of it. But it's still here.
Thank you. I want to thank Gail and Ling Ling and Becky for being with us this morning, and I thank you for being with us. And we'll see you next month. Thank you.